Hey everyone, welcome back. Today, we're diving into something that doesn't get talked about nearly enough, even though it affects millions of men worldwide. I'm talking about venous leak, also known as veno-occlusive dysfunction. If you've ever been able to get an erection, but can't keep it, or if it goes away the moment you change positions, this might be what's going on. So let's break down exactly what venous leak is, why it happens, and, most importantly, what you can actually do about it. First, let's talk numbers because this isn't some rare condition. Research shows the global prevalence of erectile dysfunction ranges from 3 to 76%. And here's the thing, venous leak is one of the most common causes. Studies estimate that by 2025, approximately 322 million men worldwide will experience some form of erectile dysfunction. That's not a small number. And when you look specifically at organic erectile dysfunction, meaning ED caused by physical problems, rather than psychological ones, studies report that around 86 to 89% of those cases involve venous leakage. So if you're dealing with this, you're definitely not alone. Now, what exactly is venous leak? Think of it this way. When you get an erection, blood flows into your penis through arteries. As the pressure builds up, the veins that would normally drain blood out get compressed and essentially shut off. It's like filling up a balloon. The blood goes in and stays trapped, keeping everything firm. But with venous leak, those veins don't compress properly. Even though blood is flowing in just fine, it's also leaking back out too quickly. This causes a person to lose rigidity or their erection entirely. You might be able to inflate the tire, so to speak, but there's a hole in it, so the pressure never builds up enough. The telltale signs are pretty specific. The hallmark symptom is difficulty maintaining an erection, where you might get one initially, but it softens or disappears quickly, often before or during intercourse. Maybe you notice the erection never gets fully rigid, or it disappears when you shift position during sex. And here's a big one, if medications like Viagra or Cialis aren't really working for you, that's often a clue. These drugs work by increasing blood flow into the penis, but if the problem is blood leaking out, more inflow alone isn't going to solve it. It's like trying to fill that leaky tire with more air. It helps temporarily, but doesn't fix the fundamental problem. So what causes this? There are actually two main types. There's congenital venous leak, which some guys are born with. These men often report they've never been able to maintain erections sufficient for intercourse, even from their first sexual experiences. Then there's acquired venous leak, which develops over time. This can happen from aging, where the smooth muscle tissue in the penis starts to deteriorate. Some researchers hypothesize that erectile dysfunction from aging may result from atherosclerosis, induced cavernous cell ischemia, leading to cavernous cell fibrosis and subsequent veno-occlusive dysfunction. Basically, poor blood flow over time damages the tissue, which then can't trap blood properly anymore. Injuries to the pelvic area, diabetes, cardiovascular disease, these can all contribute to developing venous leak. Now here's where things get interesting. For a long time, treatment options were pretty limited. Doctors would try medications first, even though we just talked about why. They often don't work well for this specific problem. Vacuum devices with constriction rings could help. Some men trap blood mechanically. And then there were invasive options like penile implants, which work, but require surgery and replace your natural erection mechanism entirely. But there's been a real shift in recent years, with minimally invasive procedures called venous embolization. This is where it gets exciting. The procedure involves accessing the problematic veins, usually through a tiny catheter, and then blocking them off with medical-grade embolic agents, basically a specialized glue. By closing off these leaky pathways, more blood stays trapped in the penis during arousal. In a 2014 study on 18 patients, almost all patients reported an immediate improvement of their situation, with most participants experiencing improved erections at 13 months follow-up. And before you go thinking this is just one small study, there's more data backing this up. A meta-analysis of 212 patients showed technical success rates ranging from 86 to 97%, with around 59.5% of patients reporting partial or complete improvement in their situation. Now, I want to be real with you here. 59.5% means it works well for about 6 out of 10 guys. That's not perfect, but for a condition that's notoriously difficult to treat, and where other options have failed, those are actually pretty encouraging numbers. The safety profile looks good too. Complications were rare and minor, occurring in only 5.2% of cases. In one registry of 50 consecutive patients, procedural success was achieved in 98% with no major adverse events on follow-up. Most guys experience some mild to moderate discomfort during the procedure, but it's done as an outpatient. You're not staying in the hospital, and most people get back to normal activities within a few days. Now, I know what some of you might be thinking. What about surgery? There's a surgical option called venous ligation, where they literally tie off the leaking veins. And look, the short-term results can be promising. But here's the reality. Studies show an initial success rate of 80 to 90% in the first 3 months. But this rate drops to around 50% after 1 year, with recurrence rates of 30 to 40% within the first year. Plus, surgery comes with additional risks, like penile shortening in 10 to 40% of cases, potential curvature, and the usual surgical complications. So while it's an option, many specialists are moving toward embolization as a first-line treatment because it's less invasive with comparable or better long-term results. The diagnosis process is pretty straightforward. If you're experiencing these symptoms, your doctor will typically start with a detailed medical history. Then they'll likely do a penile Doppler ultrasound, usually with an injection that causes an erection, so they can see exactly what's happening with blood flow. End diastolic velocity, measured by duplex ultrasound, is typically greater than 5 milliliters per second in patients with a venous leak, while normally it's less than 5. Some centers also use CT cavernosography, which provides incredibly detailed three-dimensional images of the venous system. One study found CT cavernosography to be superior to conventional cavernosography for site-specific venous leak identification, achieving 100% identification compared to just 19.4% with conventional methods. This level of detail is crucial because it helps doctors see exactly which veins are problematic and plan treatment accordingly. Here's something important to understand. Not every case of ED is venous leak, and not every venous leak case is the same severity. Some guys have mild leaks, where medications or constriction rings might actually be enough. Others have moderate to severe cases, where more aggressive treatment makes sense. And sometimes there's mixed vascular insufficiency, where you've got both an inflow problem with the arteries and an outflow problem with the veins. These combined cases tend to be more severe and harder to treat. So if you think this might be what you're dealing with, don't just ignore it or keep trying treatments that aren't working. See a urologist or a sexual medicine specialist who can properly diagnose what's going on. Be honest about your symptoms when they started, whether medications have helped. All of that matters for getting the right diagnosis. And remember, erectile dysfunction often signals other health issues, particularly cardiovascular problems, so getting checked out is important beyond just sexual function. One more thing I want to touch on the psychological side of this. Living with ED, especially when you can sometimes get an erection but can't maintain it, is incredibly frustrating. Studies show that men who are more satisfied with their body image, particularly their genitals, tend to have less anxiety about sex and lower levels of erectile dysfunction. The mind-body connection is real. Anxiety about performance can actually make the physical problem worse, creating a vicious cycle. So if you're pursuing treatment, don't neglect the mental health aspect. Therapy, whether individual or couples counseling, can be incredibly valuable. Alongside physical treatments, the bottom line is this: venous leak is a real, diagnosable, and increasingly treatable condition. We're not in the dark ages anymore, where your only options were pills that don't work well for this specific problem, or jumping straight to implants. Embolization offers a middle ground, a minimally invasive procedure that targets the root cause and has shown real promise in clinical studies. It's not perfect, success rates vary, but for many men, it's restoring natural erectile function without major surgery. So if you found this information helpful, and you think it might help someone else who's dealing with this, please hit that like button. It really helps get this kind of content in front of more people who need it. Thanks for watching. Take care of yourselves, and remember that getting help isn't weakness. It's just smart healthcare. See you in the next one!